Good morning, everyone. We'll get started in just a moment here. Good morning and welcome to the Thursday, March 18th, COVID-19 Response Media Briefing. I'm Frangie Mays, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Lacey Fehrenbach, Deputy Secretary for the COVID-19 Response, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, and Dr. Scott Lindquist, Acting State Health Officer. I would also like to welcome Abigail Echohawk, Executive Vice President with the Seattle Indian Health Board. To begin today's briefing, we'll open with remarks from Secretary Umair Shah.
Great, thank you, Frangie. Can you hear me okay?
We can, go ahead.
Well, good morning, everyone. As you know, we've been coming every week sharing information about what's been happening across the state of Washington, but in particular related to COVID-19. And I just want to start by introducing myself again. My name is Dr. Umair Shah, I'm the Secretary of Health for the state of Washington. And I, though usually start with what's happening within the state, I think it's really important to take a moment and just talk about what's happening in other parts of the country, and particularly yesterday with 8 individuals who were murdered in Georgia in an act of needless violence. As we all know, this tragic event, as horrific as it was, appears to be the latest attack on Asian Americans in this country. In 2020, hate crimes against Asians in America rose 150%. And since the start of COVID-19, the pandemic in our nation, Asians around not just our country, but around the globe have felt the impacts of racism, including dehumanization, discrimination, and physical violence. I am greatly concerned, as you can imagine, about this blatant racism, as we all should be, and the fear and terror it has put on our communities. As the Secretary of Health for the state of Washington, as a physician, and as an Asian American, I'm committed to fighting, along with all of you, racial discrimination in all its forms. This is just one of the many communities in America that continue to be impacted by racism and its effects on their health and well-being. And we should all be reminded today just how important our mission is to bring equity and optimal health to all, especially those who have been historically marginalized. As a state agency, we can work towards protecting the health and well-being of all communities while committing to practices that reflect what we need to really see throughout for all people in the state of Washington. COVID-19 has brought out the best of us, but it unfortunately has also brought out the worst in us. And we must do better and stand united against racism in all its forms. I stand committed to that. I know the governor stands committed to that. And certainly all of us at the Department of Health stand committed to that. So I wanted to start with those comments. I also want to recognize that next Tuesday marks the 1-year anniversary of Governor Inslee's stay home, stay healthy order. And we know a lot has transpired over this last year. Just this past week, we also saw the anniversary of the World Health Organization declaring COVID-19 a pandemic. And we have come a long way since then, thanks to vaccine and everyone's hard work to stop the spread of this virus. But I do want to also recognize our partners in Seattle, King County. And as you saw in the New York Times this past week, the Seattle area has had the lowest death rate of the 20 largest metropolitan regions in the country. And I really want to recognize the work that's happened, not just in the King County area, the Seattle community, as well as across the state. Because if the rest of the United States had kept pace with Seattle, the nation could have avoided more than 300,000 COVID-19 deaths. And I think that's remarkable when you think about having such a horrific start to the pandemic in the state of Washington and how far we have come. But I think it's really, again, incumbent on all of us to continue to make that progress, because we know we're not out of the woods yet. And what I mean by that is we must continue driving down disease rates in our communities through vaccination and all the other prevention measures, as we have previously seen declining case counts, which has gotten us down from this third surge, but we have now started to see flattening across the state. We've had a total of 331,109 confirmed cases of COVID-19 in the state of Washington and 5,156 deaths. While we continue to know COVID-19 is in our state, we do see good news, and hospital admissions and even deaths as of early March both continue to decline. But as I mentioned, we are starting to see a flattening or a plateauing of that across the state. And Dr. Lindquist is going to be talking more about that as well. The decrease in hospital admissions is steepest in the oldest age groups, age 70 plus, and we believe that may have been related to the increase in vaccinations in that age group. Case counts have plateaued in the state as a whole at the same time we've had levels we were seeing in early to mid-October last year. So in other words, while we have decreased significantly from the third wave, we are still at levels that we were seeing in the fall. So we want to see those numbers continue to decline, and that unfortunately is not happening as fast as we would like. 5 of 39 counties have 14-day average rates above 200 new cases per 100,000 people. And last week, 6 counties met this criteria. Cases are increasing amongst younger people, ages 10 to 39 across the state. And this has previously been an early warning sign of larger surges in the general population. Again, Dr. Lindquist is going to be talking about this, but we need to be concerned about this flattening, this plateauing, and certainly about the detection of more cases of variants of concern. The good news is we continue to see great progress on vaccines. We've had more than 2.5 million total doses given in the state of Washington. And we are very much at our goal of 45,000 vaccine doses per day on average. If you remember, when we set this goal previously, a couple of months back, we were at that 13,000 vaccines doses that were given per day. We've made a remarkable amount of progress in this regard. But that said, we are now in the midst of continuing to look behind the scenes of what additional goals will be, especially as we increase our supply and see an increase of supply from the federal government to the state of Washington. We've also had a 120,000 plus 123,000 doses that have been given at our state mass vaccination sites. And we've also seen significant progress that Michelle Roberts is going to talk about related to vaccination in our seniors, as well as where we are as a state in terms of the percentages of our population that have been vaccinated. But I will say that we've seen more than 21% of our state's population has received at least one dose, and more than 12% are fully vaccinated. We're truly making progress. And yesterday we moved into phase 1B tier 2, as you all know. And that means about 750,000 people are now eligible for COVID-19 vaccine than the day before, including high-risk critical workers in certain congregate settings, pregnant women, ages 16 and older. And certainly we want to continue to remind everybody that this is so critical from an equity perspective, that even those who are disabled, individuals who have a disability that puts them at high risk for severe COVID-19 illness are also now eligible. We also know that communities of color have been disproportionately impacted by COVID-19, and they are overrepresented in many of the high-risk critical worker groups and those jobs that they continue to have to attend to. So in other words, people can't just take off from work. And that's why it's so critical that we move into this next phase tier of 1B2. If I could show the slide that you guys have, I'd like to talk a little bit about a few things related to COVID-19 vaccination efforts. As I've described before, that there is a real three-legged stool of vaccine rollout in the state of Washington. And as you all know, every stool that has three legs has to be strong in all three of those legs. And that includes, in this case, the supply side, the logistics side, and the demand side. The forefront leg of the stool is always going to be changing and evolving. Right now, what we've had is the stool has been imbalanced because of supply constraints of vaccine. What we are looking at is in the next several weeks that our federal government partners have told us that the supply is going to be increasing significantly. And the second piece of the stool is the leg is the logistics. And we want to continue to make sure the logistics are strong and nimble and able to handle the increase in supply that's coming in. And then the final leg of that stool is demand. And we are really concerned that we are going in time, especially to have vaccine hesitancy be a significant driver of really how we're going to be able to get vaccines to everyone throughout the state of Washington. And I'm really pleased that Abigail has joined us today. There has been a lot of misinformation in many communities across the state of Washington and across the country. And I really want to underscore how important it is that we continue to get the right information so that vaccine demand does not decrease. And we want to make sure that we do everything we can to get vaccine to everyone in the state of Washington. We go to the next slide. What we've also been looking at throughout the state of Washington in our vaccine efforts is what I call the 3 E's of vaccine. That one part of it is excellence, another aspect is equity, and the third aspect is experience. These are not easy in any sense of the word. As you all know, it's been a challenge in the world of vaccines to be able to do all the different things that we had to do. But what is also key is that when we look at experience, the excellence is very much about the throughput and the numbers and the efficiency and the effectiveness of the vaccine efforts. And again, just incredible amount of kudos to all the folks on the ground that have been doing so much work in this regard. But we also want to make sure that it's not just about numbers, it's also about equity, that no matter who you are or where you live, that you have access to vaccines. And that's absolutely critical from an equity perspective. And we are championing so many different activities related to this at the state level. And we're working with our local partners to make sure that equity continues to be a key driver of our vaccine efforts. And finally, the experience. We want to make sure that Washingtonians have the best experience, the optimal experience, the positive experience as they go through this process. And that has been a challenge throughout, given all the different changes that have occurred across both policies at the federal level or supply constraints in the three-legged stool, or all the other aspects of how that appointment, that final appointment is gotten by the Washingtonian. So excellence, equity, and experience. As part of the excellence efforts, we certainly have our VAC Center that's up, and you've had Dan Laster that's been able to speak to that. And with our equity efforts, I want to also give again an acknowledgement to Paj Nandi on our team, who has tirelessly worked along with other people in his team, on his team, for making sure that equity is a continued driver with our vaccine implementation collaboratives. So with that, let me close off these slides and get back to the fact that progress has continued to be made as we move forward with our vaccine efforts. And the good news is that progress is now also being reflected with recovery from a broader standpoint. As you all know, on Monday, March 22nd, the entire state will be entering phase 3 of the governor's roadmap to recovery. From there, we continue to evaluate progress made county by county. While it's not time to let down our guard, it's certainly exciting to see continued steps towards moving to our new normal. Let me transition to schools. More and more schools are returning students to in-person learning. This is a crucial step, as you all know, to support students' behavioral health and educational needs. This past week, Governor Inslee signed an emergency proclamation requiring all public K through 12 schools in Washington to provide both remote and in-person instruction opportunities. The governor has also tasked our agency, as well as the Healthcare Authority, with making recommendations for supporting the behavioral health needs of children and youth over the next 6 to 12 months. We know the pandemic has had significant impact on many people's health and well-being. Young people are especially vulnerable to higher levels of stress, anxiety, and hopelessness. These impacts have amplified the isolation of remote schooling, social distancing, and other measures we have taken and had to take to control the virus. Providing more opportunities for in-person learning, along with other changes as vaccines pave our way forward, will help young people tap into important emotional supports like friends, extended family, teachers, coaches, the entire ecosystem that schools in person can provide, and certainly that's been missing. And our agency has begun coordination with HCA on those recommendations, and we will continue to provide updates as we make progress. Let me go to my last point, and then I will turn it over back to my colleagues here. Another hopeful development as we move toward normalcy, or some semblance of normalcy, is continuing to see new partnerships, strategy, and funding and resources from the federal level. As you know, the American Rescue Plan that was passed last week includes much needed relief for communities, health systems, businesses, and workers. And we know the CDC will receive billions of dollars to track, administer, and distribute COVID-19 vaccines. That's the form of $7.5 billion. Nationally, $47.8 billion will go toward diagnosing and tracing COVID infections. Also nationally, $2 billion will go toward buying and distributing testing supplies and personal protective equipment. The plan will provide $350 billion to help states, local governments, and tribes cover unexpected costs associated with the pandemic. And each state will receive $500 million, with more coming based on each state's share of jobless workers. We look forward to helping implement the American Rescue Plan because we believe it's going to not just benefit public health in Washington, but Washingtonians. And we're committed to working with the governor and with our partners on how to most effectively invest health-related money into our state. The Office of Financial Management at the state will work with state agencies such as ours on how and when the money coming to Washington will be distributed. And we anticipate the money will help our battle against COVID-19. Our battle against COVID-19 really has to continue to echo all of us being in this together. We must champion equity. We must champion working with all of our providers and a variety of partners, including our tribal vaccine partners. I'm so honored today to have Abigail Echohawk, the Executive Vice President of the Seattle Indian Health Board, who's joining our briefing today. She's going to provide perspectives on what's been happening in our tribal vaccine efforts. And I also want to recognize just her leadership throughout this pandemic as well. I also want to recognize Dr. Lindquist is going to provide some additional data. Michelle Roberts is going to be providing additional vaccine information. And we have Lacey Fehrenbach here for additional questions and answers. And with that, Frangie, I'll turn it back over to you.
Thank you, Secretary Shah. Next, we'll go to Executive Abigail Echohawk.
Thank you, Dr. Shah. I greatly appreciate the opportunity to share some of the experiences going on in the vaccine distribution with American Indians and Alaska Natives. We're in a very concerning time. We recognize that Native people are 3.5 times more likely to be infected with COVID-19 and almost 2 times more likely to die as a result of those infections. Indian country, which includes the 29 federally recognized tribes here in the state of Washington, in addition to the 2 urban Indian health programs in Spokane and Seattle, have been working tirelessly to provide services and especially now vaccine distribution to our populations. Unfortunately, we are seeing a targeted attack of misinformation to American Indians and Alaska Natives regarding the efficacy of the new Johnson & Johnson vaccine. And in fact, there was a recent op-ed published by a Washington state physician in Indian Country Today, one of our largest tribal news sources nationwide, that challenged the efficacy and warned tribal people from getting that vaccine, saying that it would not work and they would not receive the benefits of getting a vaccine. And I'm here today to say that that information is untrue. The science of the Johnson & Johnson vaccine shows that the efficacy is across all races and ethnicities. There are no findings within that study that showed that any race or ethnic group did not benefit from that vaccine. And we have to see that vaccine along with the other 2 that have these emergency authorizations as tools in our toolbox to ensure the health and well-being of our communities. It's concerning when we see that a specific racial or ethnic group is being targeted with misinformation, and it's our responsibility as public health professionals within the state, within the tribes, and the counties to ensure that we get the proper information out to our people. And again, no evidence has been shown that this does not have efficacy within the American Indian and Alaska Native population. The one thing we are seeing across these vaccines is that there are not enough American Indians and Alaska Natives who are being enrolled in these clinical trials, and we are working tirelessly again to ensure that there is more Native people enrolled in these clinical trials to ensure that we are part of help shaping the science that builds our nation forward stronger after this pandemic. And in addition to that, we know that tribes and the urban Indian organizations across this state have been one of the key partners with the state of Washington in getting people vaccinated. And in fact, on Monday, the Seattle Indian Health Board, where I serve as the executive vice president, we vaccinated more than 150 teachers for the Seattle Public Schools as our teachers get ready to go back into the classrooms to serve our children. The Suquamish Nation also is vaccinating teachers in Kitsap County, again, regardless of race or ethnicity. We are working tirelessly to ensure the health and well-being of our people. And especially as we think about the efficacy of these vaccines, we do not want targeted misinformation that is working to look at the many Native people have mistrust in vaccines and the government as a result of historical mistreatment. However, we know these vaccines are safe for our people. And so I urge tribal people, whether you're living in rural or tribal settings, to reach out to trusted sources of information, the Department of Health here in the state of Washington, your local public health departments, also the CDC, and trusted organizations such as the Urban Indian Health Institute, which I also direct, along with the Northwest Portland Area Indian Health Board, as we are putting out tribally specific information on the vaccines. We are excited to continue to be a partner with the state of Washington as we work to serve our people and all people in the state of Washington to get back to a place where we can get back into some of our normal world and be in a place where this pandemic isn't what is driving forward all of the concerns that we're seeing right now. So again, thank you for this opportunity. And again, reach out to trusted sources of information to understand the vaccine and make a good choice on whether or not you want to be vaccinated.
Thank you, Executive Echohawk. Next, we'll go to Assistant Secretary Michelle Roberts.
Good morning, everybody. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. I'm so thankful that Abigail was able to join us today and talk about some of the amazing success we've had in partnership with the tribes and our urban Indian health centers as they have helped vaccinate both their own members, but also be an important place for community vaccination as well. As I've said many times before, vaccine is the best tool we have to stop the spread of COVID-19. We are so proud of the work that healthcare providers like the Seattle Urban Indian Health Institute across the state are doing to vaccinate. The latest data show that about 2.5 million doses of vaccine have been given in Washington. More than 66% of people 65 and older have gotten at least one dose, and more than 40% are fully vaccinated. That's incredible progress. Those older adults in our communities have some of the highest risk of severe outcomes for COVID disease. And I'm so thankful we're making progress to keep them protected. This week, we took another big step forward, moving into phase 1B2 and opening up eligibility to about 740,000 more people across the state. This is the next group of our essential workers at highest risk. We know there are many other workers and other people at high risk because of underlying conditions that are still waiting their turn to be vaccinated. We are hopeful that with anticipated increasing supply over the next month, we can get to these next groups quickly. It is important also that people who get a 2-dose vaccine, like the Pfizer and Moderna vaccines, complete the series as close to the recommended time interval as they can. People who receive the Pfizer vaccine should get their second dose 3 weeks or 21 days after their first dose. As for the Moderna vaccine, you should get your second dose 1 month or 28 days after your first dose. This week, we got new data from the CDC that shows how many people are getting their second dose. I'm happy to report that nearly 9 out of 10 people in Washington got their second dose on time. But about 9% of people were still within the allowable window when the report ended. And a little bit more than 3% did not get their second dose. Our statistics, these statistics are very similar to the ones we're seeing across the nation, but we know there's room for improvement. DOH is working with partners across the state to figure out why some people aren't getting their second dose and to encourage people to go ahead and make sure their appointment is made and get in there for your second dose appointment. We encourage providers and to make sure second dose appointments are made when people are getting their first shot. If an appointment is canceled, please make sure that it gets rescheduled. And providers, please help us in continuing to send reminders to people when they're due back for their second dose. We really want to make sure everybody has the best protection possible for these vaccines. And for the Pfizer and Moderna vaccines, that is getting both doses. It's important we all work together to achieve this goal and ensure everyone who receives a COVID-19 vaccine completes the series on time. Looking ahead, we're hearing good news from the federal government about vaccine supply. Right now, our 3-week forecast is pretty steady. We expect to receive about 345,000 doses of vaccine each week now through early April. That's still about 110,000 fewer doses than what our provider facilities are requesting. But we're being told there may be a light at the end of the tunnel. This week, we got a small allocation of about 8,400 doses of the Johnson & Johnson vaccine. These doses were ordered and will be sent to counties where allocations were a bit lower to ensure that each county receives their proportional share of vaccine to match their eligible population. On top of that, April looks promising. The federal government says that next month, 30 million doses of vaccine will be available each week across the nation. Breaking that down, that means about 600,000 doses of COVID-19 vaccine should be coming here to Washington state each week in April. These doses will be divided through our weekly state allocation and through the federal options like the federal retail pharmacy program. Before I close, I want to send a sincere thank you to our community, our partners, and our staff. Because of you, more than 2.5 million doses of COVID-19 vaccine have been administered across the state. Every single person who gets vaccinated and completes the series is helping us move one step closer to ending this pandemic. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Acting State Health Officer Scott Lindquist.
Thank you, Frangie. First of all, I want to make sure I honor Miss Echohawk. A large portion of my career in public health has been dedicated to Alaska Native Americans. And I think it's quite an honor to have Abigail here talking to us. And thank you, Abigail. Appreciate it. With that, the other side of my life is being an epidemiologist. And I want to go through some trends, and I will summarize it to say that I'm cautiously optimistic, but there are areas for concern. And if you look at our data page, so our COVID dashboard, it shows the number of cases over time, which we call an epi curve, shows three very distinct waves. Waves in March, April, waves in June, July, and this large wave we had this winter. And the concerns in these waves are, as Dr. Shah alluded to, after each of these waves, so after wave one, the level of cases settled out about here. And after the end of that first wave, we saw an increase in cases in younger adults. So really 20 to 40-year-olds as an average. That seeded the next wave, which was the second wave. And that wave occurred June, July, and then settled down at a higher rate after the baseline was higher than the first wave. And again, we saw this heralding of younger cases before the third and very large wave we just settled on occurred. And what has happened after this third wave is we're starting to see the slowdown and the decrease in the number of cases, that the baseline is even higher than the first, second, or third. So those are concerning trends to me as an epidemiologist. And then the additional concern is this emergence of, right now, of the younger age case rates, which very concerning given our phases of younger age groups and the emergence of variants in the state. Very concerned what all this means. And that is why I say I'm cautiously optimistic, but this is something that DOH is doing every day, really watching the epidemiology around these concerns. The variants, we are very aggressively looking for variants. A large portion of all our positive cases are getting genetically sequenced. So as of a little over a week ago, our state public health lab has started doing gene sequencing. We also have contracts in place with labs to do gene sequencing. And in the month of February, we actually sequenced 6% of all our positives. That is a very large amount. And that really puts us in the top 3 states in the United States since the beginning, how many cases we've actually genotyped. So that's impressive. I very much assume we will be the top state soon for the percentage of all cases that we do genotyping. With that comes the knowledge of what our genotype data shows us in the way of variants. And we are now, post out a report every Wednesday at around 10:30 about the variants. I would again encourage you to go to our dashboard for COVID-19. And we are up to 156 variants in the state at this point, which is a very large number. It's very concerning. And we are watching it. The nice news is we have not seen big trends in more severe disease or death or hospitalizations in this first group of variants that we're looking at. Again, it's not entirely representative yet until we are doing a much greater percentage of genotyping, but it does give us some insight to these variants right off the bat. And the CDC really looks at 3 variants very closely. They call these variants of concern. Those are the ones that I just said. We have 156 of those in the state, and they've added 5 additional variants of interest that our group is going through to see how many cases we actually have of those variants of interest. We have on first blush noted that we have seen all of these variants of interest, but the true impact we won't know until next week's report. And with that, I really just want the public to understand how much work goes on behind the scenes to look out for variants, to look out for our incidence rates and our case rates and our hospitalizations. And that, again, we are cautiously optimistic where we are right now. but it is not time to let down your guard. It is a time to get vaccinated. It is a time to continue to wear masks, to space yourself 6 feet, and also wash your hands. So with that, I'll turn it back to you, Frangie.
Thank you, Dr. Lindquist. This brings us to the Q&A segment of today's briefing. We do have several media with questions today. If we're not able to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question comes from Steve McCarran with Como.
Hi there. Thanks very much for the question. I know that we've talked quite a bit about the concerns about the flattening or the plateauing of what we're seeing with cases right now. How big of the concern, and we've talked about this before, but is there more of a concern about a potential fourth wave? And how do things like St. Patrick's Day yesterday, upcoming spring break plans, if people have those, how much does that factor into if we'll see a fourth wave or when we'll see a potential fourth wave, and when could something like that hit?
Well, let me start with that, and then maybe Dr. Lindquist or Lacey would want or both want to say something as well. This pandemic has reminded us that regardless of where you are in any phase, things can always go the opposite way. And if you're making progress moving down and people aren't doing the things that we know are going to protect them from COVID-19, but also transmitting to others, meaning the 3 W's, washing hands, wearing masks, watching distance, and certainly getting tested so we know what's happening throughout the communities, and recognizing where we may need to work towards interrupting transmission, that those waves can very quickly, that some progress in a particular wave or a point in time can actually go in the opposite direction. As Dr. Lindquist and I both described, that we are making progress, and I know that Dr. Duchin talked about this as well last week during his briefing at King County, that we continue to be very concerned about the flattening and the plateauing. But when you have then activities that go on top of that, whether it's St. Patrick's Day or spring break or people going on trips, again, if they take those trips and they do the kinds of things that they need to do in order to protect themselves, that's one thing. But if they aren't doing those things and you essentially say, well, the pandemic is over, then that's exactly when you start to get into trouble. Obviously, it's a race against time with vaccines, which is what we're all doing, is to get vaccines out. We made an incredible amount of progress. We have a lot more work to do. But I do think that regardless of how quickly vaccines get into the state and we get them out into the arms of Washingtonians, we've got to continue to remember that we're not out of this pandemic. And so we've got to keep moving in the direction of those preventive measures, because we just don't have enough Washingtonians or Americans vaccinated thus far. So we're not there at all. And then when you bring in variants, that also brings in the additional concern. So Scott or Lacey, do you want to add to that?
Yeah, go ahead, Lacey, if you have anything.
I think just quickly, and you heard some of our panelists, Dr. Shah, Abigail, talk about the tools we have in our toolbox. We keep, the good news here is that we keep adding them. I also want to remind everyone that, we each have a role in preventing a fourth wave and determining, if there is one or how big it might be. And, you heard Dr. Shah talk about the 3 W's. We've talked about vaccines. Every single person vaccinated helps us prevent a large wave or a wave. So when your turn comes up, please roll up your sleeve and get vaccinated. We still are working to do the test, isolate, trace strategy. So, if you think you might have COVID or have been exposed to COVID, please get tested. Do not hesitate, as Dr. Shah says often, or do not guess, get the test. And certainly, if you get a call from one of our contact tracers, engage and be forthcoming in that, because that helps us identify close contacts who then can take efforts to protect themselves and others. And then, another tool we have that I want to remind people about, especially if you are going to travel or go out and about in society as things reopen, is WA Notify. And that's our exposure notification technology that, supplements contact tracing efforts and helps us notify people faster and potentially notify more people that they might have been exposed to COVID-19 and take measures to protect themselves. So, we want to keep going forward. We have a lot of tools coming online to help us do that, and we need the public to stay with us in using all of these tools.
And the only thing I'll add to this, first of all, I want to make the observation that this is the first time in a press briefing in a long time that it hasn't been a vaccine question leading this off, that we're talking about FBI. But I do want to reiterate, we are not seeing a fourth wave right now. And I want to give a very specific message to those that are 20 to 40. You are the age group that is driving the early increase in cases. So please be mindful of wearing a mask and social distancing and getting vaccine when you're eligible. It is clear in our outbreak reports that bars and restaurants are the #1 outbreak area. So we really want you to limit your exposure in bars and restaurants. It's then also in construction industry and work related issues. And of course, this is the age group that's at work. Please be mindful of this, and you have the ability to control the emergence of a fourth wave. So please do all the things we're talking about here.
All right, thank you. Our next question comes from Ariel with the spokesman.
Great, thank you. I think I'm just going to build on the last question. I'm just trying to pair, us reopening and opening more in phase 3 in a few days with what we know and what Dr. Lindquist just said about outbreaks in bars and restaurants. I'm just trying to figure out if counties aren't going to be reevaluated until mid-April. Is that not going to be too late, especially in counties where we're already seeing increases in cases in young people?
So let me start with that, and Dr. Lindquist or Lacey may want to add to it. I would say I don't think so, and the reason I'm saying that is that we have made an incredible amount of progress, and we have seen declines, and we have been working together, and we have been seeing our communities come together and doing the things that need to be done in order to move forward. At some point, we do need to reopen, and we do need to do that carefully and methodically, and that's what we've really championed at the state and throughout the state of Washington. And if you look at states across the country, we have been very careful on that roadmap to recovery. And you have seen in many states across the country where states have gone very fast and reopened fully. And I will tell you that that is not the case in the state of Washington. So while we are cautious, absolutely, while we are concerned about potential for movement in the wrong direction, we're also watching it. And we're also monitoring the data. We're also recognizing that if things change, we can always move back. In fact, we can move back quicker if we need to. So there are some things that are very much in place that we want to make sure that we are doing everything we can to move forward, but also recognizing that if the data do not show that we can continue to move forward, then we are absolutely ready to be able to take decisive action. Scott or Lacey?
Yeah, I mean, the only thing I'll add to that, Ariel, it's a great question. It's a concern that all of us on this panel worry about every day, but we monitor this data daily. Just because we're talking about looking at it in April and reassessing doesn't mean that we aren't looking at it every day. So rest assured, this is one of the last things I think about when I go to bed at night, and one of the first things I think about in the morning when I wake up. And I spend my day really answering these questions that you pose, which I think are great questions and great concerns, but it's on all of our minds.
And just quickly, a reminder that we're very concerned about cases. That's an early indicator and tells us trajectory of disease and burden of disease, but we're looking at other data points, including our hospital admissions, and deaths, and both of those are continuing to decline, largely in part to the vaccination of the most vulnerable and the people at greatest risk for severe disease in our state. And then just, for clarity and to put a point on Dr. Shah and Dr. Lindquist's notes, we have the authority, the secretary has the authority, and local health officers have the authority to move a county or the state back if we need to, because we see concerning trends. So that exists in the system above and beyond the metrics being evaluated every 3 weeks.
All right, our next question comes from Daniel with the Inlander.
Yeah, so there's been a lot of praise, obviously, for Washington State keeping its death rate so low with COVID. But we've also seen that, we have Oregon, Washington, Utah, and Idaho are all among the dozen states with the lowest death rates. I guess I'm sort of wondering if there's something about the Pacific Northwest in particular that has allowed our death rates for COVID to be so comparatively low.
Yeah, that's a great question, and I'll tell you, coming from Texas, that was one of the reasons that I came to the state of Washington, because I thought it would be a very good place to make sure to continue in the right direction. But that's part of the answer. The answer is we don't fully know if there's anything different in certain states than others, but I think policies matter and leadership matters. And when you follow public health, that matters. And so there are some very important considerations when we look at what's happening in a state like Washington. Obviously, we can't speak to what's happening in other states fully because there are different nuances in every state, and every state has approached this differently. And I think that's been the real challenge of 2020 was that all the policies, there was really not a unified strategy across the country. And unfortunately, the pandemic is already a year in as we start to look at what could that have been if we had a unified national strategy. We don't. And so there are a few nuances, and I know Dr. Lindquist may be able to add to this, that there is a recognition that when you are, for example, more outdoors, there is an opportunity to not be as close in contact with other people. When you have systems that are really making sure public health and healthcare are working together, when you're monitoring data and really mining that data in Washington in particular, I've been so impressed by just the incredible, even in times of uncertainty, because data have not been easy to come by during this pandemic. And I've said that data have moved slower than the disease. The fact that we've been continuing to monitor that data, I think, is also another piece of this. When you're also in, and again, not necessarily this is anecdotal, but when you're in warmer environments, it is harder also sometimes to wear a mask. And people in in some of the southern environments where it's hot, and in the summer it was particularly hot and humid in certain areas. Wearing a mask became even more difficult, not just because of all the other reasons, but just because of the fact that it was more challenging to do so in warmer climates. All of those add up to what we have, which is success. But that said, it's success that we have to continue to build upon. So Scott, I don't know if you want to add to that with some nuances, because obviously I'm coming new, so I can only give you the last 3 months of perspective. I'd love to say it's because of the mountains and other aspects of, but I don't think that has anything to do with it.
No, I think the answer to this is a very complex question. There isn't one single thing that we can point to, but all the issues that Dr. Shah brought up are obviously contributing to it. I would say we owe the population of Washington State a lot of kudos for what and how they've handled it. I know it has been very restrictive at times, but mask wearing has changed since the very beginning. I have been there since the very first case in the United States was diagnosed. And I have seen Washington from east to west adopt mask wearing and social distancing, and a lot of these community interventions that we may not have liked, and it has really been a strain on our economics, but Washington has really gone behind this. And the other issue that I would point out is all these states talk to each other. We all communicate with each other about what works and doesn't work. So it's a multifactorial answer to this, but in the top of my head is the citizens of Washington State really deserve some credit for this.
And I don't know, Abigail, if you'd like to say something on this, as being on, seeing things from a different perspective. What are your thoughts about, how that's gone in the state of Washington or compared to elsewhere?
Yeah, I think we've seen some really great strides in the state of Washington. I'm really fortunate to work across the country with urban Indian organizations. And I think one of the things that was said earlier about how policy matters, that has been one of the key things. And we've seen in particular racial and ethnic minorities who do experience the highest rates of mortality and morbidity, really noticing and seeing the impacts on their people and disproportionate death rates when they're in areas where folks don't follow or there isn't strong public health, such as mandatory masking. So it's been really great to see here in Washington State and others where we've seen these strong public health safety precautions being followed and seeing the population of people following these policy mandates that have come out. We do have to recognize that even in the low death rates that are seen across these states, there are a disproportionate number of racial and ethnic minorities. So we are seeing the deaths impact the marginalized communities more, which is why we always have to have an eye towards equity. In particular, looking at, again, one of the strongest tools in our toolbox, I don't think we could say that enough on this call, and that is the vaccines. And I will say at the Seattle Indian Health Board, all of our elders in the elder group that Dr. Shah talked about having the highest risk, over 70, we have vaccinated 100% of all of our elders. And so we're seeing successes when these tools like vaccines are placed in the hands of community health organizations who have the ability to reach those hard to reach populations or those most marginalized, particularly racial and ethnic groups.
Thank you. Our next question comes from Evan with the Seattle Times.
Hi, thanks for taking the question. Is Washington monitoring breakthrough cases, and why or why not? And if you all are monitoring breakthrough cases, what does early data tell us, if anything?
Yeah, Evan, I want to just start because I'm going to turn this over to Michelle and Dr. Lindquist. And just a reminder that this is now, you're at the fourth question, and that was the first question about vaccines. So I want to recognize that hopefully that, this is a sign that we continue to make incredible progress. So thanks for asking that. The answer is yes, but let me turn it to Michelle and Dr. Lindquist.
Michelle, I can set it up. So Evan, this is a great question. We actually are in consultation with the CDC today just about this issue, about how many breakthrough cases should Washington be expecting? Because we know the vaccine isn't 100%. So we can do some math and some modeling to see how many cases we predict. One of the main reasons, so the bottom line of that is we're in consultation with CDC about this as early as today. The other part of this is we really started a robust genotype program months ago. And the goal of this was to look at, if we start seeing breakthrough cases, getting them genotyped and finding what are our early findings from this. And I will just say we're way too early in this to give any really logical epi-analysis of it. Probably as early as next week, we'll have some more detail, but we are all over this one. And this is a big concern for us. We know we will see breakthrough cases. It's just, what is the breakthrough case look like? Who are they? Where are they? And what vaccines, if any, show a higher rate of breakthrough? All these are questions that we are posing and don't have answers to at this point.
The only other thing I will say is, and Dr. Lindquist alluded to this, some level of breakthrough is to be expected. I mean, these vaccines are between 95 and 100% effective at severe disease. And so even with that there is a level of people who will be vaccinated and get disease. And none of us are going to know for sure, is that going to be you or me who may not mount a full immune response to the vaccine? One thing we do know from all 3 clinical trials is that the vaccines are protecting against serious disease and hospitalization and death at really high rates. And so still the best protection is to continue to be vaccinated. Definitely, we need everybody helping us for all the disease data we were just talking about. By when it is your turn in line getting vaccinated, the more quickly we can use our vaccine supplies, the more quickly we can be out of the pandemic. And there's a lot to learn, like Dr. Lindquist said, and a lot of details we need to collect and understand, and also see what's happening across the country. Where things that are rare events, the more data that we can look at as a collective, the more it's going to help us understand what's going on. So that's exactly why we're talking with CDC and others.
All right, thank you. Our next question comes from Glenn with King 5. One moment. Go ahead, Glenn.
Hey, how are you? So a quick clarification question for Dr. Lindquist. You cited 156 variants, you called them, but I take it you mean cases where people have been detected with the variant?
Yeah, correct. So there are these variants of concern that the CDC lists. It's the South African variant, the South American variant, and the UK variant. Those are the 156 that we've detected. Now, again, your detection is only as good as how many people you're actually doing the genotyping on. It's very labor intensive. It's very specialized care. But like I said, our public health lab has now started doing genotyping. And this is good for a variety of reasons, Glenn, because this is a tool that is the future of public health. This is the future of public health labs, looking at outbreaks with genotyping. We use it in TB, we use it in hepatitis, and we are really turning this tool towards COVID-19. And so far, like I was saying, we're one of the top 3 states that is doing the highest percentage of genotyping. What we're finding is 156 of these variants of concern. And by next week, we'll be able to let the public and everyone know, what about these other variants of interest that the CDC is now talking about? So those were the numbers. So hopefully that clarifies what I had said earlier.
All right, well, this concludes the question and answer segment of our briefing. Now we'll go to Secretary Shah for closing remarks.
Well, I want to just close very briefly by, again, gratitude to Abigail for joining us today, and just the incredible amount of actually the power in how you articulated the messages today. And I just want to thank you for your leadership, and also for your continued voice of what is happening in not just in tribal nations, but also across the state of Washington and beyond. So thank you, Abigail, for joining us today. I also want to thank our other panelists, Dr. Lindquist, Michelle Roberts, Lacey Fehrenbach, and they've tirelessly continue to work around the clock and really represent public health, as we've seen across not just the state, but across the country and the globe, on what we really continue to need to do to emphasize to people the absolute importance that we are not out of this pandemic. And so, yes, we have tools. Obviously, we have to do all sorts of things with the preventive measures and testing and supporting our healthcare system, and obviously vaccinations, but we are not out of the woods yet. And we need to continue to move forward in a direction that is going to finish this pandemic off when we truly finish this pandemic off. We're not there yet. We do have concerns about the data related to the plateauing. We do have concerns about variants, and we do have concerns at the end of the day about the fact that vaccine supply remains continued to remain constrained in the state of Washington. We're doing everything we can to work with our federal partners, and we recognize that that is going to mean that we are going to get vaccines into our state sooner than later, more so. But I do want to recognize that three-legged stool about supply, certainly the logistics and administration aspect, and finally demand, really means that our attention is now also shifting, not just to supply concerns, which remain, but also to vaccine hesitancy. And we want to do everything we can to champion messages, again, of do not hesitate, don't hesitate, vaccinate. I think that is absolutely critical. And I know that Abigail really articulated that so nicely today. So with that, I just want to say thank you to all of you, and joining Dr. Lindquist's comment that the real reason that Washington has been successful has been our communities and our people. And they've been doing, and you've been doing, and everybody has been doing everything that they can do to help fight this pandemic. And again, hashtag in it together. We are in this together. So with that, thank you so much, and really appreciate this. And we'll pick it back up next week. And Frangie, we'll turn it to you.
Thank you, Dr. Shah. Well, this concludes today's media availability. I'd like to thank our panelists for their time